Okay. Hi, this is Dr. John Bennett broadcasting from Miami for Internet Medicine. Today we have the initial um, show for the Rheumatology channel. And I'll let Dr. Farhan introduce himself and tell about where he's at and what he's done. But first, let's meet the students. Let's start with Diana.
Hi, I'm Diana Medina. I'm currently attending Larkin University here in Miami, Florida, and I'm currently applying to medical school.
Welcome, Diana. LaDonna, could you please introduce yourself?
Hi, I'm LaDonna Williams, a classmate of Diana, also doing a master's in biomedical, and we're all currently together going through the suffering of the med school applications, hopefully with great results.
Welcome, LaDonna. And Marilenis?
Hi, my name is Melanis Fuentes. I also go to Larkin University, and I'm also applying to med school. Happy to be here.
And from Croatia, Slaven.
Hello everyone, my name is Slaven Gojkovic. I'm a fourth-year medical student from Croatia, currently doing the Assembly Step 1, and I'm a leader of some neurosurgical societies. I'm thrilled to be here.
Okay, welcome. Okay, Dr. Farhan, I'll let you introduce yourself and tell about what you're going to talk about today.
Oh, sure. So since we have many medical students aspiring doctors, a lot of us don't really know about rheumatology when we are trying to get into medical school. Actually, as a matter of fact, most doctors don't get introduced or get comfortable with rheumatologic diseases until they graduate from their residencies. So there is a lot of lag between the knowledge about rheumatology and how does it affect many people. So rheumatology is knowledge. It's a branch of medicine that deals with rheumatic diseases. And this term means anything that involves your joints, muscles, your connective tissue disease. It is very intricately related to autoimmunity. So most patients who come to you and are being seen by a rheumatologist most likely have either a joint or muscle disease, connective tissue disease, and they mostly have some autoimmunity connected to it. Now, do any one of you have any idea what is autoimmune disease? So autoimmune disease is, as you may know, immune system. So immune system is our innate body's ability to fight infection. It is kind of a watchdog, a police within our body to fight any invading organs, agents, infections that get into our body. So we have an army of cells, white blood cells, and within white blood cells we have about 7-8 other categories of cells that take different responsibilities. So think of it as an army, and in the army there could be a brigade of one side to the other, and they all perform one function, what is to defend our country. So the same way, immune system defends our body, which is our country. So now any invading agent that attacks our body, whether it is accidental or intentional, it will protect us. So if you get exposed to a virus, how your body reacts to it, your inner white blood cells, they form a defense against those invading organs. And later on, they recruit more and more army and create some sort of defense. It could be in the form of antibody formations. And those antibodies go and attack that agent, that offending agent, pathogen, such as virus, bacteria. And as a result, there's a fight going on at different levels, different tissues of the body. That fight is a battleground, and that's what our immune system does. So our immune system creates a sense of security for us when it is fighting against us. When we are sleeping, our immune system is working to fight against the infections that are around us. Now, this is a perfect scenario where our body is in harmony. Everything goes well, we are taking care of our health, we are eating well, we're sleeping well, and we are trying to make sure that our environment is clean and we don't get sick. But when we get sick, this immune system, whether we are awake or sleeping, continuously fighting us to remove that infectious agent out of our body. The same way happens with cancer. When the cancer cells or mutates within our body and change our genes, our immune system gets activated, protects it. Now, the situation, you have to imagine that if there is disharmony in the body, in our immune system, it would create a sense of disarray, disharmony, and chaos. And that chaos, as a result of this dysfunctional immune system, is called autoimmune diseases. So now you imagine that a country has different states, provinces. So I keep that in mind. Whatever state in we are, if there is a mismatch going on, disharmony going on, chaos going on, that part of our country is gonna be diseased. And that's would manifest in our body as a certain kind of an entity that we name a disease within autoimmune disease spectrum diseases. So imagine when this whole process of any pathogen, infectious agent, or environmental trigger causes an immune system activation, and there's a war going on in our joints that results into rheumatoid arthritis. So that when the immune system is fighting and causing inflammation within joints, it's called rheumatoid arthritis. Now, it doesn't mean that it only attacks rheumatoid arthritis, only attacks our joints. It is also affecting our inner systems, such as lungs, heart, blood vessels, brain, kidneys. A lot of us don't know that. But think of it as that this immune system has become now dysfunctional and is now attacking our body. So let me summarize. Immune system is our defense system, which protects us from infections. Autoimmune diseases are when this immune system becomes dysfunctional, and now rather than protecting us, it finds that after taking care of an invading agent, it has now started attacking our body. And that results in autoimmune disease. Now, our rheumatologist aim is to create the immune system to take care of this dysfunctional immune system so that it continues to protect us, but stop attacking our body organs. Any questions about this basic concept of immune system? It's becoming dysfunctional and causing autoimmune disease. And then I'll go a little bit more deeper into our 3 major diseases that are prototype diseases in rheumatology. So our panelists, if they have any question about this. Okay.
Okay, any well, one comment that I'd like to make is that generally America, before these students were around, about 15, 20 years ago, you probably remember, Farhan, when AIDS came around, everyone started learning how important the immune system was, because as you know, that's a disease of the immune system. And then people started to learn how important the system is. I just want to comment on that.
Yeah, that's a great point. And a lot of diseases that are manifested as HIV are because the immune system is totally compromised. In that disease, the virus attacks our defense system, the cells that protect us to fight against infectious agents. They change within that DNA and creates a multitude of diseases. So
I want to make a comment also, if you hear me well. Do you hear me well?
Yes, we can hear you.
Yeah, okay. The connection is right. I was just, I'm constantly amazed how how important these diseases are, I mean, all the types of hypersensitivity reactions and rheumatoid arthritis, as you mentioned, how many people suffers from this. I mean, they cannot even have a soft blanket without excruciating pain. So I'm really looking forward for you to clarify some concepts about this, because as far as I saw, there's never enough knowledge about these diseases, and it's such a high-yield topic right now. So thank you.
Kevin. A great point. Yes, and we continue to know and explore. Rheumatology is still a very growing field. It's many big research universities are spending a lot of talent and money in exploring how we can treat these immune diseases. But I would like to think about, in future, how can we prevent these diseases? As you know, our body is created in a perfect harmony if we take care of it. And certain diseases are created as we have put ourselves into situations that cause trouble to us. Just like being at a wrong place at the wrong time, being with people who can cause trouble for you and for the environment, can get you in serious trouble and accidents. We have seen many movies where a good kid is in a bad company and gets in trouble. And that's the same thing. Our immune system and our body is meant to defend ourselves, and it keeps working fine until we put it in an environment that creates disharmony. So we take ourselves, experiment ourselves with things that are not meant to be in our body. And by that I mean, we all know that viruses and bacterial agents are, to some degree, are not controllable because they are part of our body. But if we are not eating well, not exercising, not sleeping well, we compromise the immune system. And if we are eating food which is full of genetically modified material, full of chemicals that are harmful to our body, if we're putting makeup on which is full of environmental toxins, all of this is absorbing through our cells, our skin, going into our body. Now, our defense system is very sensitive sensors, and they would pick these particles entering into our body. Imagine our GI tract. It's a huge, it's like if you spread it out, it's more than it's more than the size of a football stadium. And if you spread it with the toxins, all of it is going to absorb in the soil. The same way what happens is when we put chemicals in our food and they are not under our control, we are not conscious of what we put in, this all goes through our intestines into our blood vessels. And that's why we see a lot of immune diseases in countries where we have lack of knowledge about food and environmental toxins. And this whole thing changes how our genes are. And this now phenomena is called epigenetics. So I feel like that epigenetics, how we change our genes by our environment, leads to new cells or creation of cells that are disarrayed and dysfunctional, that then lead to development of autoimmune diseases. So it is first, I feel like the future doctors, people like you, who will be the future doctors, should think of how you can tell prevention is better than cure. Because when we came into medicine, what we only learned is how to treat a disease or a condition. We are in the reverse model of treatment. We take a disease and then we start treating it backwards. But the future of medicine should be how doctors help people stay healthy and prevent diseases. How doctors can be the leaders in the community to lead the way for changing how our crops are being created, how our material in the food that goes in is being created. We need to be the leaders in that, because we have always been on the passive end of health spectrum. People come to us after they have gone through eating McDonald's and all unhealthy food all their lives, and now they have cardiovascular disease, and we take them to the cardiac lab, cath labs, and put a stent, and then 6 months later put another stent and another stent. I've seen patients who have 7 bypasses surgeries. I mean, this model does not work. What we need to do, the future doctors, is to understand how the human body is and how to preserve it so that we prevent diseases. We're going a little off of topic, sorry about that. So I'm going to come back to rheumatology. So now imagine this dysfunctional immune system is fighting an environmental toxin that we introduced, or a virus or a bacteria, through our skin, through our intestinal tract. And now there is a war going on. That war is called inflammation. So autoimmunity is linked to inflammation. So my mnemonic to remember this is called AIR. AIR, A stands for autoimmunity, I stands for inflammation, and R stands for rheumatology. Autoimmunity and inflammation leads to rheumatologic diseases. So if we take care of immune system, we can prevent inflammation, we can prevent rheumatic diseases. Now, this is not 100% challenge, because many things happen that are not in our control, such as infections. We can't control them. There's no guarantee for it. And that's why there will be immune diseases, rheumatologic diseases, but not to the degree that there's, we are seeing now in this day and age. So at this point, I want to elaborate a little bit of inflammation. Inflammation is, as you may all know, anything which is red, hot, is painful, and can't function. These are the signs of inflammation. Can somebody give an example of anything that comes to a mind that is very consistent with something called inflammation? Any example?
Acute appendicitis, that's the most common.
Excellent. Acute appendicitis.
Or
Has anyone heard of gout?
Of course, yeah.
Gout. Gout? Yeah.
Very common disease in elderly patients, and I mean, it's also a point of a very interesting disease, metabolic disease of urate.
Yep. Yeah, I call it a lifestyle disease. Because, there are two types of diseases that we get. Some diseases that are lifestyle related, like being a diabetic or a hypertensive, to some degree is a lifestyle disease. And so as gout is to some degree is a lifestyle disease. It's a disease common in Western countries, in people with affluency, high enriched food with more purines and high amounts of fructose. So there's a lot of, this debate can go on and on in terms of what disease humans we give to us versus the environment or nature gave to us. So there is a big debate, and I feel like that we contribute more than 50% of our diseases, or 80% of our diseases that exist are contributed by our own mankind. So inflammation, now you guys know that anything which is red, hot, inflamed is inflammation. Now imagine that this inflammation in rheumatologic diseases can be in somebody's brain. And when it happens in the brain, it's called cerebritis, means cerebral inflammation. And diseases that can cause it is lupus and vasculitis of central nervous system. So you have an inflamed brain.
Mm-hmm.
Yeah.
There is a question I must ask you. Usually they say that females in the, how can I say, females in the age around 25, 30 to 35 years old, I mean, in the best age, get those autoimmune diseases more often. So what is your comment about why is this more prevalent in females? Because there are many interesting stand views, one view was in Zagreb from one of our famous pathology professors, is that women eat themselves up more about troubles in everyday life. They run more, and I don't know, do you agree with this, or I would like to hear.
I have to say that is a very good question. And I think that very thoughtful people think about it. When I was young, I was like, yeah, because guys are cool. Guys are better, that's why. But you were smarter. So that's why you thought that, okay. No, women are the defense system of our environment, our homes, right? Moms, wives, daughters, they carry a lot of baggage. Okay. So as your professor said, there's a direct link with stress. And people who do multitasking, their immune system decreases. Now, most men like to watch movies and have a beer on their couch and enjoy and chatting with their friends. But most women, if you look around in their lives, they're cleaning their homes, taking care of their kids' lives, their husband's life, their own professions. So their immune system is multitasking, and that results in lack of there's some weaknesses that develop in their immune system that create it. Now, this is a very simplistic approach, and by no means I'm a scientist. I'm a clinician who likes to think a little bit to bring logic to it, to make me understand what it is. Now, one more thing I have to tell you, which I think is another big responsibility, or that unfortunately happens to women, is environmental exposure to chemicals. Now, how many men you think wake up in the morning and put so much stuff on our mouth, on our face, lipsticks, and the things that make women feel beautiful, right? And that is something that I think has a close relationship of development of autoimmunity is linked to the to the toxins that are touching their body on a daily basis in large amounts. Now, people used to say it's X and Y chromosome, and it is because of the estrogen, but I think that there is more linked to this is what the environment that they live in and what chemicals attack them and what quality of chemicals are being absorbed on their skin on a daily basis in large amount that go and trigger their immune system to chemicals that shouldn't be in their body, and that trigger immune system to become hyperactivated or become dysfunctional and lead to diseases. So my thought process is more on the epigenetics level, and also because of their multitasking on a day-to-day basis for their life. So any other comments from the panels? It's a great question.
I just really like this
one. Yeah.
Just this what you mentioned, epigenetics. I think this is a really a big clue here, because epigenetic remodeling, because all of these autoimmune diseases are really on the molecular level. I mean, in lupus they attack the nucleus. I mean, the anti-nuclear antibodies and others, which is really so. But I would also like, if I may, I would like to ask girls here, what do they feel? Why is that so? I mean, do you think that about this is more, as you said, some diseases are lifestyle diseases. So, I mean,
and that's why men get gout, because they sit around, they don't eat healthy, and they're drinking too much beer.
yeah, exactly. My grandpa has gout, and my father has rheumatoid arthritis. So it's
puzzling. It's puzzling. Why? So, and be honest with you, the ratio between male and a female in autoimmune diseases is 9:1 ratio. It doesn't mean that men don't get autoimmune diseases. And I think that's why there is some role of epigenetics and some genetic component to it, because I've done a study at University of Michigan during my fellowship, and the study focus was how lupus in males is different than in females. And so the answer is it's much less common in males, but when it happens in males, it's mostly very poor outcomes. So when a man becomes lupus, his outcome of life and mortality is much worse than a woman. And why this happens is just like, most men don't survive heart attacks if they don't have a good support system, or if in general, men don't survive crisis very well, health crisis. And I think that's the same concept goes to when they get lupus pretty bad, and their survival is poorer than a woman. So that is my concept. So I realized that the main brunt of autoimmune diseases in women is epigenetics because of the exposure of the chemicals. And the second hit theory is their overwhelming abilities to keep the families in the community intact because they're managing multiple things at one time.
Yeah, I'd like to ask a woman in the panel a question. Have you or any of your family been exposed to autoimmune disease or severe allergic conditions?
No one in my family.
Nobody in your family? Okay. Marlene's or LaDonna?
As far as I know, no major autoimmune issues. For the most I can think about for allergic reactions and things like that, or maybe atopic dermatitis.
How about lupus?
No lupus.
Okay, good.
Okay.
So let me tell you guys an example about myself. When I was about 11 years old, between 11 to 14 years old, I got diagnosed with a disease called rheumatic fever. Now, and when people ask me, why did you become a rheumatologist? I said, because I got a rheumatic fever when I was 11 years old. What else can I become? So the reality is, rheumatic fever is another example of how autoimmunity in childhood is different than when it happens in adults. So when I was 11 years old, I got strep throat and multiple times of strep throat. And what the cause of it is if you grow in a socioeconomic environment which has not as clean environment as Western worlds, you do have more chances of diseases. And either your immune system is going to fight it and you get stronger, or if you are a kid who is not as strong physically, can get into constant trouble. So I was one of those kids in my childhood who used to get sick a lot. Now, I got so much attacks of strep throat that eventually my immune system started attacking my own body in the form of these inflammatory cells that autoimmunity developed within my body and attack my joints. Now, this rheumatic fever can also attack your cardiac cells, because those immune cells, the antibodies that are formed, anti-streptolysin or ASO antibodies, they go and attack your joints, cause inflammation there, because they're trying to find that streptococcal pathogen. And once they find anything that has a genomic copies similar to joints, they would go and attach there. So somehow we believe that sequence of genomes was present in this joints, and that's where they get involved. And the same pattern of that can be seen in cardiac cells, and they get it affected. So I got myocarditis, or cardiac valve involvement, mitral valve prolapse, and mitral valve regurgitation, and I had rheumatic fever, which affected multiple joints. So I had, as you would imagine, a young kid, 11 to 14 years old, with polyarthritis. I couldn't walk, couldn't get up, couldn't go to school, and it took about 4 to 6 weeks of testing and hospitalization to get diagnosed what happened to this kid. So I still remember those 28 days in hospital, where every day I used to have a panel of doctors and medical students come around, sit around and ask questions and discover it. So I went through a slew of testing, and eventually they diagnosed me rheumatic fever, which is the correct diagnosis. I'm happy they did it, because for the next 11 years, every month I got a penicillin shot in the butt, because that was the treatment, benzathine penicillin. It was most painful injections anybody can go through, and I got for 11 years every month once. And what happened is that reduced that immune activation, and these antibiotics actually prevented further infections, and my immune system eventually got normalized, and the autoimmunity response went down by use of anti-inflammatories. And at that time, and I think to this date, we use aspirin and NSAIDs. We don't use steroids, thankfully so, in kids. But that was used for me to not have pain and attacks. So the reality is that the trigger in my immune system at that time was the infectious agent. Now, as we get older, this infectious agent could turn into a food that is mixed, genetically modified food that we eat, or I would say, you know how a modified food, GMO containing food, is cooked in an environment like a fast food style. And if you keep eating that, eventually you are going to cause an immune disease, because you're exposing your body to environmental toxins. And that's how people develop autoimmunity. So that was my story about how autoimmunity, I got interested into it, and how then eventually led me to develop interest in this field. So I
have a question, Doc.
Sure.
Was it, did it take a while to be diagnosed? Like, how many doctors did you see before someone figured out you had rheumatic fever?
So fortunately, what happened is the doctors, I must have seen 20 doctors, but I did not have to go and see them. My dad actually took me to a hospital where they admitted me. And they kept me in that hospital until they diagnosed me. So the hospital system is different there. It's, I grew up in Pakistan, and where I had, my dad was in army, and they have really big, good hospitals where I got admitted, and they kept me until they diagnosed me. So they called doctors from different places, and different consultants came in and saw me. I didn't have to go, but they kept me there for a month. Mm-hmm. Wow. So I must have seen maybe 10 doctors or more.
Okay.
because every day there was a different team of people coming and rounding and then discussing and seeing what it is, and they would order tests and stuff like that.
Well, generally speaking, in America now, does a patient have to see a lot of doctors before they would be diagnosed by something like rheumatic fever?
Rheumatic fever is very uncommon in America. I have seen only people older than me in America, maybe 20 years old, that had rheumatic fever, because the environment was much better in terms of socioeconomic status of people, environment, and things that this, once we get a kid who is strep throat, we don't send them to schools. My kids now, when they get a strep throat, or a student in their school, or in even their garden, they have strep throat, they keep them at home, they give them antibiotic, and then they send them. When they were school, we had strep throat, we did not know. We were going to school infecting everybody else. And that's why, and then those health systems don't have that much quick diagnosis. Now, I have to say that I should not say that it took about 28 days to diagnose, because I remember that part of it was they did not let me go until I felt better enough to be home. So this 28 days that I remember, maybe half of it was diagnosis and half of it was recovery, and that's how I got released.
Okay, but generally speaking, in America, to get an autoimmune disease diagnosed, it generally takes a while, correct?
2 years. Average between 2 to 8 years is the period for diagnosis. So let's give an example: polymyalgia rheumatica, which is a very common autoimmune disease of elderly patients, commonly seen in 60 and above, affects your shoulders and your hip girdle area. It's manifested by morning stiffness, joint inflammation, and very common in elderly. About 18 months to 2 years is the common time period where they would get diagnosed. And this is a very common disease. Now, if you talk about Sjogren's syndrome, which is dry mouth and dry syndrome, and as we all know now, it is common in autoimmune diseases. Most women, they're so busy in their lives, they check up to it. It takes 8 years for a woman to get diagnosed with Sjogren's syndrome, even in America, because they think, oh, I'm taking this medicine, that's why my mouth is dry. I'm tired, that's why my eyes are dry. I'm wearing contacts, that's why my eyes are dry. So there is an average time period of 18 months to 8 years, depending upon what disease we're talking about. Scleroderma can get undiagnosed for a long time, because what it does is it causes fibrosis of the skin. People start looking younger in the initial part of time, and their skin creases go away. People like that. And they don't realize it until it is hard, like leather, that actually something is going on. So it really depends on high vigilance. Now, in America, the primary care doctors are extremely good in ordering testing, which is good in a way that everybody, a woman who has joint problems now, goes to a primary care doctor and mentions it one time, they all get anti-nuclear antibody testing. And that anti-nuclear antibody testing is a very sensitive test. And for the reasons it is made as such a sensitive test is, if 9 women or 10 women are tested and one has real disease, the test most likely will come positive in more than half of them, because then those will get diagnosed by more questioning to find out the real one case. So a test, when it is made sensitive, means you don't want to miss out the real patient. So if 10 people complain of a joint pain and out of them only one has lupus, the anti-nuclear antibody may be false positive in 4 of them, but real positive, true positive in 1 of them, but 4 get to be evaluated in America to be screened for an autoimmune disease, because we don't want to miss one person who has the real disease. And that is not happening in many other countries, but in America, that's the standard of care. That's why we have now, in the last 10 years, since I've become a rheumatologist, I've seen a lot of patients who are just a small titer anti-nuclear antibody positive, and they get be seen by a rheumatologist to be watched closely, because there is a condition where you develop antibodies 7 years before actual disease develops.
Mm-hmm. Yeah, well, there are also many examples. I can't help but share very briefly one case of my good friends from LA. They were both neurosurgeons, and then the wife of my friend got when she started neurosurgical residency, she got symptoms of lupus. And what happened is that it caused some endocarditis problems, and she would eventually fall, how can I say, she would faint and get syncope. And this manifested so rapid that she needed to stop her residency, and now they're both in biomedical research. So it's a very important issue of today. I mean, when she gets an attack of rash on her body, she cannot take a normal shower. She needs to be showered under pressure. I don't know. They have some special device to do this, and it's really a major problem. So I'm really sorry for them. They're doing a great job. They're doing researches on glioblastoma multiforme. So I'm really hoping that this will be a breakthrough there. And I mean, so many people fighting these diagnoses. So I mean, I just wanted to share how important these diseases are in people's lives.
What good thing about autoimmunity is I've seen many celebrities and elite athletes. They talk about their experiences about autoimmunity so that people can get awareness. As you may all know, Serena Williams, I believe she has Sjogren's syndrome. There is Selena Gomez, which is an upcoming singer in the United States. She recently told that she has lupus. And those are diseases that are common even in celebrities. Michael Jackson has discoid lupus. So there are many celebrities who had these diseases that were never diagnosed. I am not 100% sure, but but I've read it in somewhere. JFK, one of the greatest presidents of the United States, had ankylosing spondylitis. And at that time, he had quite a difficult time because there was not good treatment, and he required a lot of medicines to control his pain and ability, which is a common disease in males, not as common in females. And it is the only good example when you talk about autoimmunity in males is ankylosing spondylitis. So you're absolutely right. The awareness about autoimmunity is important, because as we spend so much time treating these diseases, I believe that there should be a team of thoughtful leaders who educate people to prevent these diseases, because I believe still, I will always say prevention is better than cure. Why do we spend so much time in diabetes, treating complications, blindness, and dialysis, when our culture promotes drinking soda over water every place we go in? So are we not going to get diabetic? Yes. So we're going to spend millions and billions of dollars on treating complications of diabetes because we sell water expensive than soda. The water bottle is $2.50 most stores, and a soda is 99 cents or below. So you are incentivizing people to be making choices which are difficult, because it's in human nature. Everybody needs money to live life, and they have expenses. And if you sell one thing cheap, one is there, and it's sweeter versus it's causing. So all of those things are important. And I think the future doctors are only going to be leaders and respected in the industry of health industry and other is when we promote health and wellness rather than treat diseases, because we have better understanding of diseases. But we are put to the task at the end, and we're just treating there, and we can never keep up, because we are made to stand on the other end of the spectrum where people are coming to us sick. But if we start here, where people are actually starting their life and they get coached to be healthy, and we as doctors do that, then we will be respected. Because you know what happens in America now? Everybody else depends on doctor to generate the revenue to treat the patient, so everybody else gets paid. So you know what doctors do? They see every 15 minutes one patient, because 5 other people's jobs are dependent on you seeing sick patients. That's how the health system and the revenue system work. So the doctors.
Yeah, that's an important point. You know, Farhan, and since we have the students here, I am one of the doctors that's totally ignorant about nutrition, like most doctors that were educated in my time period. There was very little time spent on on nutrition in medical school. Now, I don't know if it's different now in medical school or even pre-med. Now, how do you guys feel about that, Slav and the students? Are you getting much education on nutrition?
Well, you know, I hate to be the one who talks all the time, so girls, please don't let me. But I would just like to mention there was a saying by Hippocrates, you know, that was "Qui bene nutrit bene sanat." That means who feeds well, he heals well. That means that, you know, today I think the nutrition is really recognized as one of the most important topics. At least, you know, I got this notion, you know, when I was taking my biochemistry class, I had a really good teacher who taught us some important things, and she kind of made this perspective in my mind. If I don't appreciate nutrition, I will be a good doctor. Let's say, in period. That was my, you know, I got this. So I think this what Hippocrates said: who feeds well heals well. That means that, you know, if you know how to feed your patient well, that's half of healthcare. Let's say. I mean, it's so important that basically, but you know, also feeling as well as autoimmune diseases. These are very connected. So I think that there is not enough knowledge in nutrition as well.
Preventive. Did you, Farhan, and when you were educated in Pakistan in medicine, did you get much nutrition training in medical school, pre-med?
No, unfortunately, no.
None. Yeah, I got none.
I did not get. The interest in nutrition started when I was a fellow in University of Michigan. We were treating a patient who had lupus, and she was a patient of our chief of rheumatology. At that time, he was director for American College of Rheumatology. So most senior rheumatologist that I've ever seen and known and worked with, and most respected rheumatologist. He was treating this patient with lupus. Mm-hmm. And she, it's a clinical, interesting story to share about nutrition and how fully informed doctors are, and that's where we are, you know. So she was treated by him for about 3 years, and she also had a comorbid illness, HIV. So she was on antiretroviral therapy, and she was also being treated for lupus. She started in last 1 year of her presentation. She had multiple fragility fractures. So she was in her 40s. It was very surprising that a 40 years old with HIV and lupus has osteoporotic fractures. So the one thought was that maybe she's on steroids. So the rheumatologist last 1 year was just lowering the steroids to help reduce the osteoporosis related adverse effect, which did not do any clinical improvement. And actually she had more continuous these fragility, hairline fractures in her areas. And how he would find it out, she would complain of pain. He would get an x-ray and he would see the compromise of the bony architecture. Mm-hmm. So it led him to do a little bit more research, and he got involved with some multidisciplinary doctors. And what they realized, she had developed vitamin D deficiency causing osteopenia, leading to fragility bones. Mm-hmm. Now, this was the first time he ever got interested in vitamin D and bone health in autoimmune disease patients. Now we know a lot about that. So what happened is the antiretroviral therapy was preventing the absorption of vitamin D in that woman. Mm-hmm. Mm-hmm. And that led to deficiency of vitamin D and compromise of bone structure, because as a result of this, you develop osteopenia, osteomalacia, and your bone architecture is poor. And that woman, for so many years, lived with undetectable vitamin D level, leading to this, because she was on antiretroviral therapy. So I did in US residency programs, there's something called morbidity and mortality conferences. John, you know, we do that. So I presented that case as a fellow because my director, he said, Farhan, you seem to have interest in nutrition. I have this case that might be of interest to you, and it's a learning case. It's actually a blow on my own self, but I am willing to share this with my peers and the rest of you because we all learn as we do practice, but I had no idea that this was the problem. So that was the interesting part of it. So when I presented this, how ignorant or how less important nutrition is towards doctors, I have one of my program directors at that time was a physician who is a very good clinician, but did not believe that nutrition has much to do with our diseases. He was from Australia, and vitamin D in Australia and sun, he laughed at me. He said, Farhan, you are going to waste all of our time talking about vitamin D on this M&M conference coming up. I heard you're going to talk about vitamin D. I got laughed at. But that I did not get discouraged by the fact, because within 5 years of 2007, if you just search the literature, the medical literature got immensely enriched. Studies relating to vitamin D in that era of 7 to 2012, and now everybody talks about vitamin D. That was the time when we started getting interested in it. And to John, to answer your question, I studied for 2 years to become a physician for integrative medicine, where I learned clinical nutrition and how it relates to diseases and how medicines impair our ability to absorb diseases, nutrients that then lead to diseases. Because most of us doctors, we prescribe medicines, statins, just an example. We have maybe, I don't know, 50 million people in America or even more who are taking statins, the cholesterol-lowering medicines. They cause deficiency of nutrients such as coenzyme Q10 and magnesium. We doctors, we prescribe the medicine, but we never know what it affects on the nutrition. And when people find it out on Google, they feel how ignorant the doctors are. And that leads to they're not trusting us because of the fact that they think how doctors can ignore this common fact that a disease, a prescription medicine that is being given to a patient, they talk about all the side effects that the pharmaceutical company told them, but pharmaceutical company never talks about nutritional deficiencies, and doctors never talk about that either. Our job is to actually tell people about the diseases, the things that pharmaceutical companies are telling out. That's their protection. Our job is to know what it affects human beings on their nutritional levels, as well as what the side effects are from the compound itself. So I think we are in to support and second John's great point is the medical knowledge needs to change its viewpoint on approaching the disease. Is not from this where we trying where our floodgates are just gonna blow out of our control. But
yeah, let me make a quick comment first. Something that affects me personally. It affects me and my family. We have, as you know, you can get genetically predisposed to heart disease. And in our Western culture, heart disease is so common. And this book talks about some cultures where heart disease is basically non-existent. It's a disease of Western civilization. And all the times I've been to my cardiologist, not one has mentioned nutrition. Not one has mentioned how to lower cholesterol. Of course, they give me statin, like you said. They give you a pill and go away. But we're of the generation that just prescribe medication and really don't know anything about nutrition and how a patient should eat. And the doctor will tell you, lose weight. And you say, well, how, doc? Tell me how. How do I lose weight? What kind of diet should I use?
You know, there was one cardiac surgeon from Mexico. Facebook. You have this bag of Mexican nachos, which are really with how can I say, with pepperones. It's really hot. And they on the back side you have a free cardiological exam, ticket when you buy a package of these. It's really, I mean, that's one of the ways to do it.
That's it.
You
So,
can buy
I mean, even now with us doing our masters, they're still kind of focusing on just how to deal with whatever disease that pops up. But you're seeing a slight change as they're beginning to notice that, okay, maybe, we need to focus on how preventing these people. Yes, we want to be doctors and we need to have patients to treat, but we need to figure out how to keep these patients healthy and just to get them on that perfect nutrition. Outside of the doctor's office, obviously a lot of nutrition fads have been coming up. So I think that's what's now causing a change for doctors to kind of more slowly shift towards nutrition, but it's a very slow shift.
Yeah.
It hasn't become anything major yet.
Yeah. I think the first step is teaching nutrition in medical school. Wouldn't you say, Doc?
Exactly. I think that we need to pay attention the same way we pay attention to pathology and to physiology, is to how nutrition, nutritiology, or the nutrition in clinical medicine has to be a course and has to give at least an emphasis worth 5% of the total curriculum or more, because we need to change how we affect it. Because now I have started incorporating medical fitness into my practice, and how that happened is people, when I used to talk to them about lifestyle, nutrition, how to change their diet to an anti-inflammatory diet, I am talking to them about how they can also stay in good shape to prevent, prevention of obesity, so that the joints don't hurt, and they involved in physical activity. They ask me things they should do. Fortunately, my wife is a personal trainer, and I learned from her some of the tips that I don't tell her, that I'm trying to be smart in front of patients and sharing them all the knowledge of medical fitness, or the fitness tips, like encouraging patients to do bar exercises, to do yoga, to do Pilates, to do spin classes. So the future of medicine, of a doctor, would be a doctor more of having a day where they would be participating with exercises with their physicians, with their patients, maybe conducting a class of yoga in their clinic, where people will pay them to join their class with other health practitioners, and kind of get to know them better on a personal level. We do a 5-minute, 10-minute visit with a doctor, and we can only prescribe one medicine, but that's not how the medicine practice of medicine should be. So that is something that we have to look forward to. And yeah, there are hurdles and politics and big hurdles, but we need to look beyond that and say that our role as a physician should be to prevent diseases.
Yeah. There is a change. I just wanted to say that in the USMLE Step 1 right now, which is really, I would say, the leader of medical board exams for young physicians in the world, I mean, much emphasis is put on nutrition today. So I just, because there are many questions, related to which vitamin causes what. I mean, the best.
Wow, yeah, I'm very impressed. I did not know that. Very impressed.
It's really, I mean, you usually get questions about, I don't know, anemias or neurotube defects. I mean, the basic principle to explain, why is nutrition so important is that if a mother doesn't take folate in critical periods of her pregnancy, baby has a great chance to get born without cranial vault. I mean, without brain. So this is a very nice way to put it. Why is nutrition important? And I was a girl here who just recently took the MCAT. Is this emphasized in chemistry portions of the MCAT as well today, or nutrition or vitamins, or did they ask you this on MCAT?
Yeah. So, John,
No.
I think we touched base on something which is a little bit different than what traditional curriculum of rheumatology is, but I think I feel this is the basis of inflammation. Nutrition, lifestyle is the basis of inflammation, and I think once we get that taken care of, then we can talk about the end result of it, if this is gets undiagnosed, and it will convert into diseases such as rheumatoid arthritis, which is a disease of multiple joints getting inflamed at one time. So let me touch base quickly on a little bit about rheumatoid arthritis, and I can share with you guys a cool source that might be of interest to medical students if they want to look up a reliable source on rheumatology. It is developed by collaboration with some of the thought leaders in rheumatology in the United States, and it's called Rheumatology. So I'm going to share that text on this.
Okay, screen share?
Yeah, we can do the screen share, or I can text also this web address on the Google chat here, and then I'll share with you guys the.
Okay, I can share it. Yeah, okay.
So let me see the screen share part.
Okay. Let me see if I can punch it up here. I've got it up, Doc, if you want me to share it.
Oh, okay, sure. Did you open it? Okay, good.
Yeah, I'll go share it here. Okay. You got that? You see it?
Yeah, beautiful.
So this is Rheumatology. So the free online rheumatology textbook. Okay, so you don't need to carry a big book, and you don't need to carry. You can just go in diagnosis search, and this is the user's guide, and you can see what you really want to know. So it's like rather than going to Google, you can come up here and find something which is really important for you to know. So this is by diagnosis. So you can say, let's go down to rheumatoid arthritis. Let's say.
Should I click the diagnosis or?
Yeah. So we can go into diagnosis first.
Yeah, rheumatoid, Doc. Where do you want me to go, Doc?
Rheumatoid arthritis. Let's do that.
Okay, there we go. It's a little hard to operate here.
I think.
There we go. I got it. There we go.
So now a lot of things that doctors don't know or medical students don't know. In the world of medicine, there is something called ICD-9 codes and ICD-10 codes. It is a strange phenomenon, which is now I understand it is in Europe and in America and all Western worlds. Every disease is given a mathematical number and an alphabet that determines what it is based on, and that's how doctors get paid for what they do. That is the reality of life. So we never knew about it until I became a rheumatologist and I started my first practice. And somebody said, what is the ICD-9 code for rheumatoid arthritis? I said, what is that ICD-9 code? Oh, ICD-9 code is how you get paid by the insurance company, what you're treating the patient for. Okay.
Right, okay.
So, but just to say that it does include ICD-9 and 10 codes, but that's something that not really that related to you now at this time. But definition: RA is a chronic progressive systemic inflammatory disorder in which joints are primary target. The classic presentation of RA is symmetric polyarthritis, particularly small joints of hands and feet. Early arthritis is often accompanied by constitutional symptoms such as fatigue. So. What is polyarthritis? Meaning more than 5 joints involved in one time, and symmetric means if you have right hand and left hand. So a rheumatoid arthritis patient would come to you, would say, both of my hands have these joints, and these joints are stiff, swollen. These joints, they could be involved, but they usually mirror images. So both hands get affected at the same time, and symptoms and are almost 100% or 90% very same in intensity, and frequency of attacks are similar. So, and that makes it different than if a person comes with only one swollen wrist, then that diagnosis needs to be worked up as monoarthritis rather than polyarthritis, where you have more than 5 joints involved. And it could go upwards then to involve your elbows, your shoulders, and it can start from your feet up your ankles, knees, and your hips. Whenever you think about rheumatology, always think about what joints are involved, how many are involved, and are they symmetric? And that is the basic concept of how rheumatologists look at a disease of joints inflammation versus another doctor. We try to see and put it in a picture that makes us able to make a diagnosis quicker than others. Is we try to find out, number one, if the joint is inflamed or not. So an osteoarthritis joint is deformed, but it's usually not inflamed. By inflammation, we talked about it. It's red hot and swollen. It's difficult to move. It cannot move and close. So you ask patients to close, make a fist, and they can't make it in rheumatoid arthritis. But an osteoarthritis patient may have a deformed joint of their hands, but they still make a good fist. So they're inflamed joints, and they're both hands at one time. So, and then we try to count how many joints they're involved. You can use that in the history too. So like if somebody said, oh, about 2 months ago it was 3 joints, but now there are 6 joints. So there's an additive pattern of arthritis involvement, and that needs to help us diagnose it. Now another thing you see is we also find the pattern, what pattern the disease is involving. In our hand is the biggest clue for rheumatologists. Hand gives us a big clue. If the joint is deformed in distal joints of the it's called distal interphalangeal joints. These are involved in osteoarthritis and psoriatic arthritis. So a patient with psoriatic arthritis might have involvement of distal phalangeal joints, and you can differentiate it from a rheumatoid arthritis patient who would have involvement of PIP joints and MCP joints. So in the hand, X-rays and physical examination, if you ask patients, does this joint hurt more, this hurts more, this hurts more, tell you this and this hurts more, it's more likely rheumatoid arthritis. But if it's, you see they have Hubbard nodes on deformities, or they have psoriasis patches and their nails are deformed, it's most likely psoriatic arthritis. So that is a big clue. Now, if it is both hands, it's most likely rheumatoid arthritis. And the same goes with the diagnosis of lupus. Most patients with lupus would have these small joints involvement, which are the MCP joints. So the pattern, the number of joints, number one, is it inflamed or not? And there are some other questions that you can ask if inflammation, but number two is, are they, what pattern they are and how many they are. Are they distal phalangeal, interphalangeal, or MCP joints? Are they associated with both hands, or one, and number two, and then you kind of build up your case. And that's how we differentiate between different rheumatologies. So that is one important thing to keep in mind. And in that link, you guys can also see what is the how it is affecting the symptoms of constitutional symptoms. So as we talked about, the background reason people get rheumatoid is inflammation, and inflammation is internal. It's a combustion of a burner in your body in the background that makes you fatigued and tired, and that's another symptom. And then you can do that by diagnosing somebody with antibodies in rheumatoid factor antibodies in the blood, and inflammation markers in the blood called ESR or SED-rate, and C-reactive protein called CRP that do it. And the last thing I want to tell you is that there are some specific antibodies that are only positive in rheumatoid arthritis patients than psoriatic arthritis patients or other autoimmune disease, and that is called anti-CCP antibody, and that is more specific. So if we are getting a patient that has symptoms of rheumatoid arthritis, but we can't tell if it is lupus or rheumatoid, sometimes we do this test, and if it is positive, we label them as rheumatoid arthritis, and that helps us to know what diseases, what medicines would work better in this group of patients than others. So there is a little bit more science to it that we can talk about it at some other time.
Very good. Thank you, Dr. Tahir, for the introduction to rheumatology and introduction to you. And welcome to all the students. The students are always welcome in any hangout we have, but Dr. Tahir is going to explore the area of rheumatology and perhaps later on integrative medicine, when we wanted to show them what this platform is and how it works, and we look forward to having more shows. So I'll stop the broadcast, but stay here, we'll chat. Okay, thanks everyone for coming.
Thank you.